My name is Oliver Morrish. I'm a consultant clinical scientist in radiation protection and diagnostic radiology physics. The thing that interested me in physics is this real desire to know how things work and why things work. I wanted a job that had a benefit to society. I had a passion for physics, but also a real desire to contribute. What the NHS allows you to do is have that real sense of public service. And so it allows you to have your particular skill set and use it in a way that has a benefit. So clinical scientists come in a variety of different specialities. In my particular speciality, we support the safe use of technology in healthcare. A lot of X-ray equipment can produce really high quality images, but often with quite a high radiation dose, which isn't always needed. So what we're trying to do is work out what is the information that's needed in the image, how good do those images need to be to get that information, and then work out what is the least radiation dose we can use. What we do is make sure that the equipment is working optimally, so we'll do a lot of quality assurance testing to make sure that it is behaving as we expect it to do. There's quite high standards for medical imaging equipment, and that's where sort of an interest in physics helps, because we like to understand how and why things work and then work out how that can benefit a patient. After university, I went looking for work experience. Back then, there was sort of limited opportunities, but the one place you can always find physics being used is in your local hospital. So I ended up doing some work experience in my local hospital. So there's a number of different routes. There is a graduate training scheme, that's called the Scientist Training Programme. If you've got an interest in physics and you want to deliver it in healthcare, just give your local medical physics department a call. They may have an opportunity, or they may be able to signpost you towards one of those training schemes. One of the things the NHS is brilliant at is supporting and developing people. The department I was in supported me to study for a master's degree in radiation physics. One thing led to another, and now I'm leading the department that gave me that original opportunity. There are stereotypes about physicists. Most of them are unfounded. There's a great deal of diversity in our physics community, but one of the key skills that you have to have is communication. A lot of what we do is explaining complex information. So one thing that I really like about working with the breast screening team is that it's a true multidisciplinary team with lots of different professions that work within it, from radiologists to surgeons, radiographers and physicists. And we all have our role, we all work together. I'd recommend this job because it's brilliant. If you have an interest in science, if you have an interest particularly in physics, it's an excellent way of being able to express that interest in a way that really benefits patients, really benefits healthcare workers and the population at large. There are not many jobs that have that reward.